My name is Dr. Joshua Samuels. I'm an adult and pediatric nephrologist at the McGovern Medical School at UT Health in Texas. And we're here to review the recent American Heart Association Hypertension 2021 session, Hypertension Management Throughout the Lifespan. And we're going to start with Dr. Elaine Urbina talking about pediatric and adolescent hypertension.
It's a pleasure to be here. I'm Elaine Urbina, Director of Preventive Cardiology at Cincinnati Children's Hospital, and I am a pediatric cardiologist. So my work is not only in treating children with hypertension, but also looking at epidemiologic work. So the two take-home messages from my talk were, one, hypertensive heart disease starts in childhood, and we now have data that link it to hard cardiovascular events. But my second message is we actually see target organ damage related to blood pressure starting in youth. So we need to carefully screen kids for blood pressure, treat it appropriately, and even go back in time and start primordial prevention of the acquisition of risk factors, mainly obesity.
Next, we heard from Dr. Natalie Bello, who discussed hypertension management in pregnancy and during breastfeeding.
Thank you for including me in this session. I'm Dr. Natalie Bello. I am the Director of Hypertension Research at Cedars-Sinai Medical Center in Los Angeles. And I think the two most important take-home messages from my talk today are that a blood pressure greater than 160/110 in a pregnant woman is a medical emergency. That's our really go-to cut point there. And labetalol and nifedipine are preferred first-line agents to use in pregnancy when treating high blood pressure. And we should be avoiding ACE inhibitors, ARBs, direct renin inhibitors, and mineralocorticoid receptor antagonists. And while most medications that we use to treat hypertension are excreted in breast milk, they're often safe for use in lactating women because the serum and plasma levels in the infants are very low.
And last but certainly not least in our session, we heard from Dr. Kenneth Jamerson, who discussed hypertension management in the elderly.
Hey, thank you for inviting me. My name is Ken Jamerson. I'm professor of medicine and I'm a hypertension researcher at the University of Michigan. The term essential hypertension almost gives credence to the fact that as we age, our blood pressure ought to get higher. Two things that are very clear is that even in the very elderly population, those in excess of 100 years old, that treatment of hypertension decreases heart failure, hospital admission, and prolonged survival. The residual question is, what is the threshold that we should shoot for in optimizing blood pressure in the elderly? And there's some controversy. I think that we can all resonate around a target that's going to be lower than 140/90. There's considerable clinical trial evidence and meta-analysis of this evidence. And our best recommendation is that targeting 130/80 would be reasonable for any elderly patient age 65 or greater who's ambulatory, but not those who have multiple comorbidities or are in institutions.
As you've heard, we had three fabulous speakers, and we discussed hypertension management starting in children through childbearing age and all the way through the lifespan into our elderly population. As you've heard, there is new research on all of these fronts. It looks like guidelines are becoming more harmonized across not only different societies, but also across different age groups. And as I said, you'll have to look for more research as it comes out. But thank you for joining us.